In your lives. All right, good morning. This is Senate Health and Welfare. We're continuing our meeting now in our own space. We've met already with the Senate Transportation Committee. Now we're moving on to requests that we've had in our committee regarding appropriations and the budget. And the requests are significant. We have a long list of people to come in and share really briefly what your ask is. I know we have all of your data posted on our webpage. So if you have a longer set of information, we have it, and we will look at that. We'll try to go through the list as it exists on our agenda. We may deviate from that from time to time, but that's the way that will be. You each get 2 minutes and that's it. And we have a timer. Vice Chair Kulik is our timer. So this is more like a little public hearing where we can hear from you what your healthcare asks are. Some of the asks are already in the budget. So if we see that, and I will let you know if you don't know that, I can try to let you know that, but I think you all know what is currently in the budget that's sitting in Senate appropriations. Those things probably are less concerning to you. The ones that are not in the budget are the ones that I think are more concerning to you. So that, having said all of that, thank you all for being here and being available. And as you finish your testimony, it would be great to open up a spot because I think the hallway is filled with terrific people to testify as well. And we'll just move right along. Well, thank you for your understanding on all of that. And we will begin with Jessa Barnard, Executive Director of the Vermont Medical Society. You'll just come up and offer us your testimony. That would be great. I think some of your ask is already in the budget. The SASH blueprint is 4.45 million and 840,000 for the one care fixed monthly payment piece. Then there's some other things.
I'm just gonna go like this when it's 2 minutes, all right? And then if you don't stop, I might try to.
You know what? Nobody out there hears this, so it's gonna be a shock.
Well, good morning. Thank you, Jessa Barnard, the Executive Director of the Vermont Medical Society, also here on behalf of our primary care specialty societies, the pediatricians and family physicians. We have made a lot of progress in Vermont on our vision for primary care and having enough primary care clinicians, having enough time with our primary care clinicians, having a team wrap around them to address not just physical health needs, but mental health and social determinants of health. We are concerned we are on the precipice of losing that progress, given where we are in our state's health reform progress. So here with asks where I'll call it the 2, 2, and 2. So 2 ACO programs that are on the verge of being closed at the end of 2025 as we end our all payer model. You are correct. Some of that funding is in that budget, but in the budget from the House, but not all. 2 blueprint programs. So those are the programs that really wrap around primary care practices with supportive services, with community health teams. One that I'd consider it the base core blueprint program is in the budget, but the mental health pilot program and Dulce program is not. And I will the only number I will actually give you, because the rest are in my written materials, is that this ask has actually been reduced. We have some new information because this would be to carry over, a lot of the funding can carry over from the second year into the third year of this pilot. So the need for the third year of the pilot is down to 1.385 general funds. And then the 2 other are workforce needs, and those are not in the budget currently. We know we are currently 115 primary care clinicians short, and that's growing each year. One of these is a medical student scholarship incentive program, which actually has a sunset in state statute in 2027. We are just beginning to see the return on investment of that program. The first class will just be finishing their residency program and coming back to practice when that sunset goes into effect. And there is not ongoing funding for that program. And then others after me will talk more about a family medicine training program that's just about to get off the ground. So between the 2, we can get 14 more primary care clinicians a year. Thank you. Thank you.
She has something new from what you submitted.
I have Michael Cos.
Send you the numbers. Yes, thank you.
I'm here.
And Mary Kate Molman.
I'm third.
Okay.
You're on deck. You're in the.
Yeah.
On deck.
Baseball terms.
Yeah, there we go.
So,
Go for it.
Michael Acosta, President and CEO of Pickford Healthcare, here with.
I'm Dr. Volansky. I'm running a consortium that's trying to launch a family medicine training program in rural Vermont FQHCs and critical access hospitals. So we see the problem with the primary care workforce. We have a real shortage of primary care physicians. Half our workforce is over 60 and will probably be retiring. And there really isn't anyone coming to replace them. As our population is aging, we have a lot of burden of chronic disease. So it really needs to be addressed with better primary care. So the solution, I think, is to train physicians where we need them the most. UVM programs have done a phenomenal job producing physicians in the Burlington area and also in the greater Plattsburgh and rural areas in New York. And I think if we sort of reproduce that idea and train physicians in smaller communities, critical access hospitals, they will stay, which makes sense because physicians in training are at that point where they're starting families, buying homes, putting down really deep roots, and our rural communities really need them. It's harder to practice in smaller communities and smaller hospitals. If you've trained in a big academic medical center, it's a completely different game. And I've watched a lot of hirees over the years take a couple of years to get their feet under them, figure out the referral patterns, figure out how do you be a doctor when you don't have an army of specialists down the hall. It's a little harder to create those networks. So we have devised a curriculum over the last years. We've been working really hard on this to create a curriculum that works in a smaller place, but meets all of the quality and requirements for good education. We have been preliminarily reviewed by the accrediting body, the ACGME, and the review committee will meet next week to finally decide on our accreditation, but we've had very good feedback so far. And then our family medicine program would generate physicians that while they're here, they would be seeing patients already in the communities. And then when they leave, we expect about half of them would stay for permanent type of problems.
Quick question for you.
Yeah.
Time is up. How does this relate to the previous question, information from the Vermont Medical Society, if at all?
I think we're all trying to solve the same problem, which is that we need more primary care physicians. All the data tells us that if we train them here in a rural environment, they will stay and live here and practice in a rural environment.
Okay, my question is it the same amount of money? I'm saying yes and no.
Well, for Maple Mountain,
For Maple Mountain?
yes.
Okay,
For Maple Mountain, it's the same
Yeah.
amount of money. They just don't have the benefit of Jess's sheet in front of me.
yeah, okay, all right. And then what about the family physicians scholarships? Is it the same?
I'm here
No,
only
it's just a
speaking.
different-
This is a different program.
I know we're over our 2 minutes. In 15 seconds or less, I would say, this program is ready to go right now. We can start in July. We need bridge funding of less than $1 million for 4 years. Once all the residents are there, it breaks even because they see Vermonters. They take care of people in our community, generate revenue, and it pays for itself. This is a program that exists across the nation and has not been subject to any federal cuts.
Okay, this is the graduate medical funding. Thank you. That's great. Thank you.
Thank you. All right. Thanks so much. I wish you all the best of luck.
Thank you.
All right, Mary Kate Mullin.
For you?
All right, good morning, committee with the chair, members, for the record, Mary Kate Molman, Director of I-State, Vermont Public Policy for I-State Primary Care Association. I get the honor of kind of continuing that conversation around the importance of primary care in the state. I also am here to express support for funding budget items that are already in the House passed bill. So the first one is 4.4 million in federal and state dollars that would help Medicaid rates for federally qualified health centers come up to or close to the cost of providing care to Medicaid enrollees. We also support the 85,000 that was included to increase family planning rates. the funding that would support the population health management payments that are currently paid from One Care Vermont to continue for this bridge year for 2026. And we also support the governor's proposal of the 4.4 million for backfilling the Medicare portion of the Blueprint for Health, patient-centered medical home payments, community health team payments, and the SASH payments. The first one really our FQHCs are currently financially fragile. This really helps bring up and gives them some financial stability so that they can continue to serve and meet the needs of their communities. The other asks really go towards what I might consider the connective tissue of our health system. It's that care management, getting them to the right provider, providing those supports that your primary care or your specialist might not provide. It's really those wraparound whole person needs. And I would say to conclude that the investment, and I really focus on investment in primary care, helps reduce the overall total cost of care. Related to FQHCs, the Congressional Budget Office, which is a nonpartisan support for Congress, found that increasing funding for community health centers, which are the FQHCs, would reduce direct spending for Medicaid, Medicare, and federally supported commercial.
Thank you. That's great. Molly Dugan. Then we're gonna have Amy Johnson.
Good morning. I'm Molly Dugan, with Cathedral Square and a member of the Long-Term Care Crisis Coalition. I'll be talking about priorities from both of those perspectives. As a affordable housing organization, I wanted to kick off with making the point that I know you all know that housing is healthcare, and I can't start my testimony without asking for folks to put more money into permanently affordable housing in the budget. The governor did put in the statutorily required revenue to Vermont Housing Conservation Board from the property transfer tax. So we need more funds than this. There's about $60 million in a pipeline for organizations like Cathedral Square to continue to build and preserve affordable housing in all corners of the state. So there is some additional funding that was put up from the House side of one time for affordable housing. There needs to be a lot more. As a member of the Long-Term Care Crisis Coalition, we represent over 200 organizations, and we need to increase Medicaid payments to these providers that provide this continuum of care in the community, long-term care services. The existing House passed budget did include important funding to get a number of two of the services up to the EVO rate study from 2023. Not all the way up, about 2/3 of the way up, but that's certainly great progress. We also support a 2% increase for community-based providers. Importantly, adult day program and skilled home health was not included in there. So we are looking for additional funds to make sure the whole continuum is included. Preserving the statewide SASH model is obviously very important to us as the statewide administrator. And then lastly, I just want to mention the SASH for All pilot, which is not in the budget now, and that's a $400,000 request for continuing this important pilot that's serving families, younger adults and families with children. Thank you.
So the estimate for adult day skilled nursing inadvertently left out is how much?
I'm hoping one of my colleagues from the coalition will share that.
Okay,
That's exactly
all right.
where it goes.
Well, my gratitude for the clarity on housing is healthcare. I've never heard it so correctly and clearly. I really appreciate that.
Amy Johnson.
Yep. Good morning, Amy Johnson, Vermont Care Partners, representing the DAs and SSAs. We are asking for a 6.2% Medicaid rate increase, which is about $14 million in general fund. We're currently in the House version of the budget, I believe at 2%. We also have language around payment reform. So it's a 5,000 person network, one of the biggest contractors for the state. We provide prevention, intervention, postvention, the crisis continuum. We're keeping people out of EDs, keeping people in communities, keeping people alive. These are state services. We're contracted, regulated, and accountable to the state, and yet year after year, the inflationary increases are not guaranteed, so that gap keeps widening. And that widening gap is a threat to workforce, which is then a threat to the people that we serve. We support the COLAs for the state workers, but we firmly believe that there should be parity with the state workers. The folks who are providing care to the most vulnerable Vermonters should be able to feel valued and live and enjoy their communities. Right now, we're running into this problem where the people supporting the most vulnerable are becoming the most vulnerable. And so we're hoping that we can see these increases to kind of keep the boat afloat and keep the lights on. That's it. Yeah.
Thank you.
Well, 2 minutes, that's pretty cool. H13 will help with that, correct?
H13 will help with us knowing how much the cost of care is.
Right.
Yeah, exactly.
Jill Mazza Olson.
Yeah, what about Michelle?
Oh, Michelle,
I'm sorry.
I
I'll sit
skipped
down.
Michelle with,
Sorry,
oh,
I just.
yeah,
It's okay.
thank you.
I was too fast.
Thank you,
No worries.
Vice Chair.
You're welcome.
Michelle Payne, thank you. I checked you out. I didn't hear you out.
Went right on it.
All right, go ahead.
Good morning. I'm Michelle Payne. I am the Clinical Director of Outpatient Services at the Howard Center and also the Interim Director of Crisis Programs. I come to you respectfully asking that this committee support the funding for First Call and community outreach programs. The governor's proposed fiscal year 2026 budget significantly reduced this funding, and the House restored most of these cuts in the version for 93 H193. Please support this funding for First Call and community outreach programs. Today, Howard Center Crisis Services include low barrier services, 24/7 phone support, in-person community response, embedded emergency department support, mental health urgent care, and crisis stabilization beds. Low barrier services fill a critical need in the continuum, engaging individuals in crisis with outreach, support, and relationship building necessary for engagement in additional services. If these services are cut or reduced, it will increase the demand for mental health and substance use services in our communities. Specifically, the cuts proposed include the elimination of EPSDT administrative Medicaid funding, which supports 19% of First Call for Chittenden County Crisis Services, the equivalent of 5 positions, and a primary care embedded mental health clinician position. Grant funding supporting the community outreach program, which provides crisis, low barrier, community-based services across Chittenden County, is also a part of the suggested cuts. If this funding were cut, there is not another funding source to replace it. The impact would be a reduction in available staff to respond to clients in crisis, longer wait times for clients to be seen, and increases in unaddressed mental health and substance use challenges, all of which negatively impact some of the most vulnerable people in our communities. So again, I respectfully urge you to support keeping the funding that the House has put back in the budget. Thank you.
Thank you. Jill Olson. Yeah. I think there's some confusion somewhere about embedded positions, and this is one, and this is where they are. Welcome.
Thank you. Good morning. Jill Mazza Olson. I am the Executive Director of the VNAs of Vermont. We represent Home Health and Hospice, and here today also representing the Long-Term Care Crisis Coalition. So we support the partial funding for the DEVA long-term care rate study updated version as passed by the House. So that's about 2/3 of the money we asked for this year, and we're really urging you to support it. This is money for at-home choices for care, so people who would otherwise be in nursing homes, staying home instead, and also for enhanced residential care. Those are the 2 services that have not gotten to rate study level. These people would otherwise be in facilities. This saves money right now today. You want them in home or in ERC instead of in facilities. It's cheaper. And then we're also asking that adult day and skilled home health be added to the 2% increase. Okay, you're pointing at me.
Yeah,
So-
what's the, you know the amount on that?
So I know the amount on skilled. Skilled is about 184
Yeah, okay.
Okay, and 75, 76 general, but we don't have a number
Okay.
for adult day. We're trying to figure it out. I do know also there's been some sort of technical questions about this, but I think, and I will be happy to be corrected, what I think is happening is that there are some monies for adult day that are not their base rate, that aren't their regular rate. So there's like a little bit of the grant and there's a little bit of moderate needs money that they get. And so the words adult day are appearing on the spreadsheet page, but it's not their base rate. So that's what I think is happening. Yeah,
Thank you.
you're welcome. And I have a copy of a few things, hard copy, if that's helpful to you, Senator.
Yes,
for
that would be
work. And then you'll see in my written testimony that we submitted, I just gave you what the web report shows, so you could kind of tick and tie it.
Nice.
Yeah. So thank you very much.
Can I ask a question?
Yeah,
Is the skilled nursing in the rate study?
No,
So it's in, so your ask is not in the rate study, what to do?
no, the rate study is only for long-term care.
Okay.
That's all Dale. Skilled home health is a medical service. It's a DIVA thing.
Okay.
So yeah, it's not in the rate study. The rate study doesn't even touch skilled home health. There is a rate study for skilled home health, but it's a different one. Saying that is probably a little confusing. Because there are two. Yeah.
Chilling out about more later.
okay.
Thank you very much.
All right. Yeah, Allison. Yeah, that's what I'm doing. Thank you. You do it. All right. Keep going. All right.
Good morning. My name is Allison Calderera from Capstone Community Action, and I am testifying on behalf of the Vermont Community Action Partnership, which includes all 5 of the community action agencies serving every county across our state, 43,000 Vermonters. We are requesting an additional $6,025,000 designated to the Housing Opportunity Program under OEO to be distributed to the 5 community action agencies. These are all critical dollars designed to reduce homelessness in our service areas. The specific requests include $2.4 million to stabilize families with an expansion of the proven success of the home family voucher program. 155 Vermont families benefited from this essential rental assistance, necessary as they work toward housing stability and sustainability. These critical dollars will extend the current vouchers from 2 years to 3, giving families valuable time to improve their economic situation. It would also support vouchers to an additional 50 families. To put the need for these vouchers in context, there were 434 applications last year for these vouchers. 2.3 million of this request will also expand staffing in housing navigation, case management, and transitional housing support that is foundational to move unsheltered Vermonters to stable lives and permanent housing. This also includes an increase in the direct client assistance funds, providing crucial homeless support, such as security deposits and eviction prevention. 1.275 million of this request includes the extension of the ERAP funding for CVOEO, Capstone, and SEVCA. These were pandemic era one-time funds that have proven critical to meet the rapidly rising trend of unsheltered Vermonters during the pandemic years. COVID has abated along with its funding, and we're still left to face the crisis of homelessness. The end of this funding stream, slated for the end of June, will have a significant negative impact on our ability to reduce homelessness. Capstone, I can speak to, will lose 44% our staff serving the Morrisville office and other positions across the state, including coordinated entry positions, funding support at CVOEO.
Thank you.
We're good.
Yeah.
Thank you very much.
So, and just, I think this very much relates to H91.
This is
And,
critical foundation
right.
stabilization. Yeah.
And just so you know, this will not show up in the budget right away. It will depend on the work that we complete here with H91, but it's important that we have that on our radar. as
Okay.
well.
Thank you very much. I appreciate
And also, Alice, if you have numbers you can send to keep.
That would be helpful.
Because I can't write this fast enough.
Yeah,
Okay,
If I haven't asked, it's because people have submitted their stuff.
we don't have,
everything that this has been, what my written testimony has been submitted, as well as our
Okay.
funding sheet.
and that was under H91, or was it for this?
It was for this.
Okay,
I haven't seen it, so.
All right.
okay.
If you haven't seen it, then we'll make sure. I'll have
we
you
haven't
follow up.
seen it.
Okay,
That's good.
I'll make
All
sure
right.
you get it.
Thank you very much.
Paul Dragon, you're up next. I'm giving everyone 2 minutes, and when you're at your 2, I'm just going like this, and then I'll just cut you off after that.
I haven't seen Paul today.
Censure.
He's behind
There he is.
Here we go.
Go ahead, Paul.
Okay, thank you. I'm ready to start. Thank you, everybody. Hello, my name is Paul Dragon. I'm the Executive Director of the Champlain Valley.
We can't hear you so well. Maybe, can you get the volume up
I
somehow?
will try. How is this? Is this a little
That's
better? Okay.
Yep.
My name is Paul Dragon. I'm the Executive Director of the Champlain Valley Office of Economic Opportunity. We have 10 programs that focus on crisis services as well as long-term solutions to poverty. In the past 5 years, we have opened several shelters to address the crisis of homelessness. We opened the Community Resource Center, or CRC, in Burlington 4 years ago, following the state closure of the Holiday Inn shelter, which we also operated. Each year, we have done this with one-time funds from different state sources, which is stressful for our organization and particularly for our staff. The CRC is the largest site in the state for people who are unsheltered. Each day at the CRC, you will find a long line of people waiting at the door, having spent the night outside. We have had several people come to the CRC this winter with frostbite, and one person had to have their finger amputated. In 2024, the CRC saw 3,100 unique individuals experiencing homelessness who utilized our services over 32,000 times. 1,100 of them were unsheltered. The data also shows that there are high rates of disability and large age and racial disparities in the people we serve. In addition to food and essential needs, we enroll people in coordinated entry and support their shelter and housing goal. Our team has saved lives, calling emergency services weekly, administering Narcan to stop overdoses monthly, providing CPR several times over the past year. The mayor of Burlington said the CRC serves as a vital piece of the city's response to homelessness, public health, and public safety, and the most highly utilized point of connection for unsheltered homelessness, at times serving over 200 people per day. We respectfully request $550,000 to operate the CRC, or we will close as of July 1st. We would like this funding to be annual with cost of living increases. Please note that each year CVOEO provides over $200,000 of its own funding for food, groceries, and essential items. Lastly, we often find small notes to our staff, and here is the latest. You are all a blessing, and I appreciate all you do. Thank you so much, and we appreciate all you do.
Thank you, Paul. And a quick question, the 550,000 would be separate from any request or any money that's in H91?
That's correct, Senator. This is just for the Community Resource Center and CVOEO to operate this center, and it will have to close July 1st because there's been one-time funding for 4 years in a row, and we've struggled to keep this together. Thank you.
Okay, that's helpful. Thank you. That's great.
Nicole, you're up next.
Good morning.
Good morning. We haven't had you in here. So welcome.
Thank you. Nicole Senior, I'm the Executive Director of Milton Family Community Center, representing the 15 parent-child centers in District of Vermont. I'm here today to advocate for the Vermont Parent-Child Center Network's request to allocate $500,000 of tobacco settlement funds to distribute to the 15 parent-child centers through the integrated grant to implement a range of evidence-based smoking cessation and prevention programming into our ACORE services. The PCC integrated grant is the base core funding for Vermont's 15 parent-child centers. The PCCs are established in statute and are required to offer our ACORE services in all regions of the state. The PCC's proposal has the potential to prevent or reduce the harms of the worst outcomes through targeted activities that would reduce the number of pregnant and parenting adults who use tobacco products, prevent parents and other household members from future smoking and vaping, and protect children from the detrimental effects of secondhand smoke in the home and in places where they learn and play. 13% of all births were affected by cigarette use in Vermont. And also how to talk to friends or family about vaping your children.
is a common parenting topic we were seeing at the center. And we've had school-aged youth and older youth expressing concerns and frustration about talking to folks in their household using tobacco. We know our deeply relational, multi-generational approach is a strategy that strongly supports cessation work and would allow us to reach an anticipated 3,000 additional individuals with this increased base funding. We've already met with the Department of Health team who leads the state's tobacco cessation activities to discuss partnership and collaboration around resources, training and referrals of pregnant and parenting smokers. The DOH team noted the critical role that the social and supports and touch points that PCCs provide in increasing success rates and expressed an interest in a PCC partnership for this work. So in closing, I urge you to please support the PCCM request for $500,000 from the Child Senate.
Thank you.
Thank you. Of our, yes, I will do that. Good morning.
Next track.
Go ahead.
I'm Shannon Carcini. I'm the executive director for the North Central Vermont Recovery Center. We're located in Morrisville. I'm here today as a member of the Recovery Partners of Vermont. I'm here today to seek your support and request that you please increase funding for Vermont's recovery centers by $1.6 million for fiscal year 26. It is important to know that this request was developed and supported by all RPV members. This is different from the governor's recovery campus proposal, and this funding is currently not in the budget as it came over from the House. Recovery centers are not preferred providers, so we do not get an automatic increase for our services, and last year we did not receive an increase. Recovery centers partner with local law enforcement, EMS, restorative justice programs, Department of Corrections, hospitals, state community partners. The list goes on and on. That's just even a little partial list. So increased funding for a recovery center means that we not only maintain our peer recovery support services, but also continue to knock on additional doors and create even more support for our community members. There are strengths in numbers, and peers working in this recovery field are ready. As our field continues to receive recognition for our expertise and professionalism and lived experience, the demand for our services are also growing. So again, we please ask for your support to increase funding for Vermont's recovery centers by $1.6 million. Recovery centers did receive a lot of support in the House, and it was suggested that this funding could come from the Department of Health prevention funds. We are not recommending that strongly, it's simply just a suggestion.
Are you talking about the opioid abatement fund or another fund?
The opioid abatement.
Yeah, okay.
Yes, thank you. So in closing, I just want to thank this committee for your time, attention, and consideration today.
Thank you.
Can I ask a question?
Some of that's already in H218.
That was it. Is this an addition to what's in 218?
Yeah.
Yes.
So
Go ahead.
there's 300 or 600 in 218?
I don't know the exact.
And then there's another 300 in the budget.
I did send the budget over.
That's for recovery residences.
There's
Recovery centers.
Recovery centers.
Yeah, they're not
This will be
currently in it.
next. She'll be there.
But
also.
it's not the recovery centers that the Department of Health has been asking for.
No, not the camp. The recovery campus is completely separate.
Completely separate.
So 1.6 above what's in 218.
For recovery centers specifically, yes.
So it's 325,000 over what is currently in the budget in H218.
Yes.
Yeah. Okay. Keep going. Quick.
No.
For clarity, to the 10-second difference between recovery residence, recovery center.
No, we're not doing that right now. We'll do that.
Amy.
Okay, who's next?
Amy. She's here. Sorry, is it resident? There's no Amy. Amy from Byrock. Community Action. Oh, wait.
Hello. I'm good, thank you.
Amy,
Hello. Am I good to go?
you're good to go.
Good morning. Thank you for having me. I'm Amy Fales. I am the Nutrition and Education Department Manager at Brock Community Action. We sponsor the Child and Adult Care Food Program for Rutland, Bennington, and Addison counties currently. I'm here actually on behalf of all the sponsoring organizations in Vermont today to ask that you appropriate $182,000 to the Agency of Education Child Nutrition Programs for FY26 budget with the purpose of these funds being distributed to CACFP sponsoring organizations in Vermont. When I first started this program 16 years ago, there were 6 sponsoring organizations in the state of Vermont. Today, there are only 3 remaining, and this is entirely due to the insufficient funding that we receive from the USDA to administer its program. And obviously, with inflation and costs rising, that gap grows every year. And historically, we've always subsidized it with other grants and fundraising sources. However, it's come to a critical point where the remaining sponsoring organizations are facing the difficult decision to discontinue this program, which would leave registered child care home providers without access to this program. And in the ripple effect of that is all the children that they care for would lose access to the meals and snacks that they currently receive. The CACFP's main goal is to increase the quality of the nutrition that the children receive in childcare, but it also addresses childhood hunger on such a large scale. Many of the children that are in childcare often don't receive sufficient foods outside of childcare, so the meals that they receive daily in childcare are just so critical. This appropriation would literally be a lifeline to our sponsoring organizations.
Okay.
Thank you.
Okay, we're good. That's 2 minutes. And do we have anything from you on this? I'm not seeing.
There is a handout that was sent by Hunger Free Vermont. I apologize for not mentioning that.
Okay, because I don't have it on my spreadsheet yet, but okay.
Okay, I'll be sure to have it resubmitted.
All right, Candace Gale.
Yeah, I'm right here.
Good morning.
Good morning. How are you? Good morning, Chair Lyons and members of the committee. My name is Candace Gale, and I'm the Director of Community Relations for Vermont Foundation of Recovery. I'm here today to ask for your support for the Recovery Partners of Vermont FY26 budget requests for certified recovery residences. It is important to note that this is separate from the Governor's Recovery Campus proposal. We are asking for your support to preserve the $300,000 in one-time funding included in the House budget, increase funding in H218 from 1.4 million to 1.5 million for operations, and secure 325,000 in scholarships to help individuals afford first month program fees. Certified recovery residences are a vital part of Vermont's recovery system. These homes provide safe, substance-free living environments rooted in structure, peer support, and strong connections to the local community. Certified to meet national standards, they serve as a crucial bridge between treatment and independent living. Members commit to their recovery through regular house meetings, drug testing, and meaningful contributions to their community. What makes these homes especially effective is their integration with local support networks. Each certified residence collaborates with recovery centers, mental health providers, employers, and community organizations to help individuals build stable, sustainable lives in recovery. In 2024, certified residences served 226 individuals across Vermont. All were connected with peer recovery coaches and local recovery centers for ongoing support during their stay. But rising costs across the board for rent, staffing, insurance, and utilities are putting a strain on operators. Without additional funding, it will become more difficult to maintain existing homes and ensure they remain accessible to those who need them most. With 1.5 million to support operations through H218, 325 in scholarship funding for individuals who cannot afford first month fees, and the preservation of the 300,000 in one-time funding from the House budget, we can open new recovery homes and keep current homes open, fully staffed, and accessible to those who are ready to recover. Thank you for your time and continued support.
Quick question for you. Do you currently have money for the scholarships? Did you have one-time money previously?
Yes, we did last year.
Okay, and so that was one-time money. And so now you're wanting to continue that from the opioid settlement.
Yes,
Abatement. Okay, thank you. That's good to know.
Mary and then Carrie.
Good morning. I'm Mary Hayden from the Vermont Association of Area Agencies on Aging. I'm here to ask you to support funding for the nutrition program Meals on Wheels. The AAAs and the meal sites are requesting $2 million for the Older Vermont Nutrition Program. That was not included in House Appropriation Committee space or in the one-time appropriations. We're greatly concerned about this given our aging population in Vermont. We're the third oldest state in the country. And given recent federal actions, which include threats to cut Meals on Wheels. We served over 17,000 people with Meals on Wheels last year. We served over 1 million meals. The program is more than meals delivered. It is also a well check and a socialization opportunity for participants. It also provides medically tailored meals to help people to manage chronic illness, and it provides nutritional counseling and education for free as well. The federal continuing resolution that was passed on March 14th level funded the Older Americans Act programs, which includes the Meals on Wheels program, through the end of September of this year, without even an inflationary increase. This is essentially a cut to our program because we need to be able to serve more children a lot less. Also, these funds would qualify for the federal global commitment match. So Vermont is missing an opportunity to draw down even more federal matching funds by not including this in its budget. In addition to the Meals on Wheels request, we support our food security partner, the Vermont Food Bank's request for $5 million budget in the total in budget. You'll hear more about that from Gary. The Vermont Association of Area Agencies on Aging is also a member of the Long-Term Care Crisis Coalition, and we appreciated the support in the House recommended budget to fund increases to the rate study levels, as well as the 2% increase for home and community services. We are, however, concerned that there's not enough money to cover the 2% increase. Thank you so much for the opportunity.
Great, thank you.
Barry and Joe, Jody,
Okay, and you can hand those around, actually, give Nolan one.
and then Susan.
Nolan, can you chat? Okay. Thank you, Chair Lyons and committee. I'm Carrie Taylor, Senior Manager of Government Affairs for Vermont Food Bank. I'm here today to ask you to support Vermont Food Bank and our network of community food shelves and meal sites by supporting 1.25 million of our 5 million total request for FY26. The last time I was here was on 3 Squares Awareness Day. If you remember, when you welcomed our neighbor Jerome into your committee to talk about his experience with food access. Today, I'm here to ask you for funding that would support people like Jerome, who relies on the food shelf at Capstone and Barry to meet his food needs every week. Across our state, our 300 network and community partner organizations are providing grocery foods and prepared meals. Many of those partners are also partners who Mary, her agency, work with to provide community meals. Those folks serve people like Jerome, who's an older adult living on limited income and needs a balanced diet to meet his health needs as a person with several chronic health conditions. These organizations serve a wide variety of neighbors who are not able to afford enough food for themselves and their families for a wide variety of reasons. Many provide fresh and shelf-stable foods and need the capacity to support that kind of food distribution. Our request of 1.25 million will support these organizations delivering critical basic need food access services to your constituents in all the corners of the state. These organizations have weathered many storms in the past 5 years. During the COVID pandemic, when pandemic era supports were in place, Vermont Food Bank and our network partners shifted to new types of food distribution and delivery. Then as those supports ended, Vermont Food Bank and our partners supported increasing numbers of neighbors accessing food. One partner, the Putney Food Shelf, recently shared that they have seen a 250% increase in the number of households they serve since 2020. Just since 2022, the increase is 158%. Those numbers are not unique to Putney. We're hearing from partners all over the state that they continue to see more neighbors visiting their sites more often and requesting more food. Please put that to 1.25 million request. Thank you.
Joanna and Susan.
Hello, thank you for having me today. My name is Joanna Doran, and I'm the local food access director at the Northeast Organic Farming Association of Vermont, or NOFA Vermont. NOFA Vermont is requesting $500,000 in base funding to strengthen Vermont farm viability and address food security by sustaining two proven programs, Crop Cash Plus and Farm Share. Each of these programs provides financial assistance to low-income Vermonters to buy fresh food from their local farmers. They've been operating for decades, and with every dollar invested, low-income Vermonters can purchase more healthy, fresh, local food from their farmers that they couldn't otherwise. Crop Cash doubles 3 Squares Vermont, or SNAP, benefits dollar for dollar for fruits and vegetables purchased at over 40 Vermont farmers markets. This means that when a 3 Squares Vermont customer goes to a farmer's market and spends their SNAP benefits, they can get a matching dollar amount of Crop Cash coupons to then spend on produce at the market. Crop Cash is majority federally funded, but it requires a local match. And so state funding is needed to continue drawing down on those federal funds. Crop Cash Plus was a 2023 pilot that expanded the Crop Cash program to all SNAP eligible foods beyond what just the federal program allowed. My written testimony includes a story from a Montpelier resident that really speaks to the need of this program and why being able to support folks in accessing meat, dairy, eggs, other forms of food is really important for sustaining their health and welfare. So state funding is necessary in order to bring Crop Cash Plus effective. And finally, the Farm Share program subsidizes community-supported agriculture shares for limited income Vermonters by paying 25 to 75% of the cost. We've been running this program for 30 years, and it's been key to food security. We need more state funding to sustain the program. And just real quick, I'll say that the House included $300,000 in one-time funding for these programs, which is enough to sustain Crop Cash and Farm Share, but not the Crop Cash Plus expansion. So we need the full $500,000 to bring back Crop Cash Plus. Thank you so much.
Thank you.
Good morning, Madam Chair, members of the committee. It's wonderful to be here today. Thank you for the opportunity to testify. My name is Susan Aronoff. I am the Senior Planner and Policy Analyst for the Vermont Developmental Disabilities Council. I'm here to ask you to support the $2.8 million that's in the House passed budget that is going to go through the Vermont Housing and Conservation Board directly to Champlain Housing Trust upon passage. It's in that section of one-times, and that is to construct 10 units of service-supported housing in Burlington for adults with disabilities. And I'm going to stop there. That my written testimony has a lot about why we need that, but I can't leave the table without saying this disclaimer I always have to say in public. My apologies, you've probably heard this from me before. I am a state employee. I work in HCP services. However, until at least October 1st, I'm entirely federally funded to receive those funds. The Agency of Human Services, through Secretary Samuelson, executes a memorandum of understanding with my executive director and chair of my board. I work for a 60% governor-appointed board, people with disabilities. I'm free to therefore depart from the governor's recommendations or the secretary's and represent the positions of our council, which are formed through deliberation and a policy platform meeting and all things like that. So anyways, always have to get that in. Thank you very much.
Thank you. And your ask is something that we've been seeing in the BAA for a long time.
Yes, and so it got rooted, and thank you for your continued support.
Thank you.
More than prosperous here.
So please for that, Ali, I don't want to.
Good morning, all. I'm Morgan Frostman. I'm the Executive Director of Building Bright Future, which serves as the State Advisory Council for Early Childhood. So that means I am your primary advisor on kids and families and all things data for the early childhood system. Wanted being that I am not a lobbyist, so I will not come in and ask your committee to vote any one way on a specific bill or anything like that. I am here to help support the state in bringing together all of the agency leaders, the lawmakers, kids and families, and community voice to say, here's what's best at any given time based on the policy priorities that we're seeing. That involves meeting the vision and long-term plan for kids and families, elevating those voices, and most importantly today, how we track and monitor outcomes for kids and families and the system of services. One of the things that we've been working really closely with all of those partners on is monitoring Act 76. And as we're thinking about transforming our entire education system, it is so critical that we know how our kids are doing, where they are, and what their outcomes are over time. So as we're seeing a growing demand for this work on behalf of both the legislature and the administration, it's really important that we have staffing capacity to be able to execute on your behalf. Just in the last year alone, we've had 150 advisements between the administration and the legislature. And that's both on how we collect data, how we consult with them on what data is needed, and bring that all to you to help inform decisions. Now more than ever, that monitoring and accountability is important because we have a really challenging fiscal climate. So what we are asking, given this growing demand, is for an additional base budget of $322,444. And that is to support both the staff, it's really basic operations. So it's staffing our contractors and our overhead. And without that funding, we are going to have to reduce staff. And that's not including the staffing that we will already and are planning to lose because of federal cuts. So really appreciate your consideration and I'm happy to support your needs.
You have yet off audience.
That's, thanks for staying under 2 minutes.
Thank you.
Valley them all.
Good morning, everyone.
Good morning.
Great to be here. I'm Allie Richards, CEO of Let's for Kids, the organization helping to lead Vermont's childcare campaign. Today, I'm here to advocate for full funding for childcare in the FY 2026 budget. As you know, in a time when we're seeing cuts for supports for kids and families, we were deeply troubled to see the governor reduce permanently the base general fund for childcare by $19 million. So instead, we asked that you restore the general fund base funding at this critical time as we are seeing successful implementation and just the beginning of a full-scale systems transformation that's working for Vermont. So before I outline our brief request, I do want to make sure to give a lay of the land on childcare for you all, since especially because this committee was key in its leadership to passing Act 76 in 2023. What we're seeing on the ground is it's working. It's really changing lives, so I think Vermont more affordable for families. It's bringing down the cost of childcare for thousands. More parents coming into the workforce. It's easier for employers to recruit and retain. But as you know, gaps remain. We're just starting the journey of building a childcare system that works for all Vermonters. So a couple examples. The public investment has helped create an additional 600 new childcare spaces since it passed. And yet about 2,000 more spaces remain to meet current need for Vermonters, especially for infant and toddler spaces. Public investment has also helped over 100 new childcare programs open, home-based and center-based all across Vermont. And yet we know there are still deserts, especially in rural areas. As these programs have opened and expanded, that's created 230 additional jobs for Vermonters in early child education. That's wonderful, but as we know, programs are not expanding because they still are facing staffing shortages and staff are not all getting compensation they need for this role. And in addition, over 1,900 families are now accessing reduced childcare costs through CCFAP. And families that are not on CCFAP are paying 25% in some cases of their income on that childcare. So good news, we've just begun a full systems transformation. It is working. We have more to do. So it is not the time to cut the general fund at this moment because the program is going to stabilize over time. Our ask is grow capacity for infants and toddlers. It's in a memo. Okay. Create a reserve, keep the base funding, and support the workforce for early child education. Thank you very much.
Caroline Chelsea, Caroline Mulliner. There you go.
Good morning. My name's Paul Gibo. I'm the Clinical Director of Easter Seals Vermont, and I'm here today to support level funding for adoption post-permanency services. Mostly, I think I'm in a position to say thank you to the House and the Governor for including us in their fiscal year 26 budgets. Last year, the legislature increased post-permanency funding by $300,000 for the state, which includes Easter Seals, Lund, and NFI services, which was the first increase in over 12 years. So we run pretty lean. Post-permanency services are available to any Vermont family formed by adoption or legal guardianship. The focus is family preservation, so preventing adoption dissolution, promoting family resilience, increasing the stability of adoptions and guardianships. And in the recent fiscal year, we served roughly 1,300 families directly in their homes, paying for overnight respite and providing support groups, and also doing community partner consultations and parent consultations. So children are adopted by aunts, uncles, grandparents, siblings, teachers, daycare providers, family friends, foster parents, and even great-grandparents and more. And while adoption is an act of commitment and love, the work often begins after the papers are signed. Adoptive parents can feel overwhelmed and isolated when they try to connect with and understand their children. And previously successful parenting techniques may not work well or at all when we're looking at children with disturbed attachment and early trauma. And it can make life confusing, maddening, scary, and stressful for both the parent and the child. And we really have found it's a truism in trauma work. A dysregulated child needs a well-regulated adult, and that adult sometimes needs some help and support. And you can find post-perm workers in schools, at an Act 264 meeting, at the Parks and Rec department, on the phone with a therapist, a pediatrician, an equine therapy program or summer camp, at the town clerk's office helping a child get a copy of their birth certificate. But mostly, you'll find us in the homes of adoptive families, where we listen closely with empathy, provide evidence-based education, support, and parenting practices, and we work closely with families when things are the most difficult for them. Thank you, is really what I wanted to say.
Thank you very much. And it's currently in the budget, so that helps.
Thank you
Okay.
very much.
Yeah, thank you. Kelsey Levis is here. Empty Arms.
You all, my name is Chelsea Levitt, and I'm the Executive Director of Empty Arms Vermont, a nonprofit organization that provides peer support for families grieving pregnancy and infant loss. I'm here today in support of our FY26 budget request of $40,000 in one-time funds, which has been included in the House FY26 budget and has gotten preliminary approval from the Senate Appropriations Committee. Empty Arms was founded in 2021 and fills the gap in perinatal loss support in our system of care for families who've had a baby die in pregnancy or in infancy. We know that 20 to 25% of pregnancies end in loss, but there are no statewide funded supportive programs in Vermont. Let us not underestimate the need for support after pregnancy and infant loss. Birthing people who experience loss in a pregnancy are 4 times more likely to have major depression and 7 times more likely to screen positive for PTSD. We know these individuals are at greater risk for substance abuse, suicidality, and job instability. I sit before you today as one of those statistics. In 2014, my first step into parenthood was saying goodbye to my son who died unexpectedly from labor complications that were unavoidable even with the best care team. Giving birth to him and saying goodbye was not my hardest day. In fact, meeting him was my very best day. Going home to an empty home with empty arms was the hardest day. Even with a supportive family and stable income, I still suffered major depression and many days wished I could simply disappear from the pain. Very little support existed 10 years ago, and it did not exist in Vermont when I moved back to my home state in 2018. While my story is unique to me, it is similar to other parents here in Vermont. I've now heard from hundreds of parents whose parenthood journey has been met with grief. But for so long, this grief has been met with silence. Empty Arms currently runs monthly support groups, yoga classes, and in-person remembrance events to connect as a community. We believe our work is decreasing higher cost of crisis care by stepping in and providing preventative peer support for grieving families. The very modest $40,000 in funding provided in the House budget will go a long way towards strengthening Empty Arms and putting us on the path of sustainability.
We're good. Thank you. And thank you for your work.
Thank you.
This is how we see an advocate grow out of a very personal need. So frequently, you know, Senator Douglas says, oh, Brad is not a lobbyist, but sometimes lobbyists are the people who have been affected the most by the issues they were.
It was a joke.
No, I got it.
Sarah's up there. She's ready to go.
All right.
Good morning. For the record, Sarah Robinson. I'm the co-executive director of the Vermont Network Against Domestic and Sexual Violence. We are the state's leading voice on issues related to domestic and sexual violence. And in 2024, our member organizations answered over 22,000 hotline calls from Vermonters seeking support. I'm here to speak with you today about two specific requests. One is for core funding. Despite the essential work that domestic and sexual violence providers do, they have been flat funded through Vermont's Domestic and Sexual Violence Special Fund for 15 years. The fund's revenues have experienced significant declines in the last decade, and the General Assembly has had to make annual one-time appropriations to make the fund whole. In FY26, the fund is again facing a shortfall. We are requesting an investment of $1.2 million in base funds in the Domestic and Sexual Violence Special Fund to prevent cuts in our field. In the House budget, this request was included in the House Healthcare Committee's letter to the Appropriations Committee, and $450,000 in one-time funds were allocated in the House passed budget. We are asking the Senate to fully fund the request for $1.2 million in base funds for core services. Second, we're requesting your committee prioritize $123,000 in one-time funds to the Department for Children and Families to prevent cuts to supervised visitation services in Vermont. Supervised visitation is used to address situations where contact with a parent needs to occur in an appropriate and safe setting. These programs have historically been jointly funded by the Vermont Center for Crime Victim Services and the Department for Children and Families. Because of budget challenges that they are facing, the Vermont Center for Crime Victim Services announced just last week that they cannot provide the expected funding in FY26. We are requesting the equivalent one-time funds be appropriated to DCF to prevent cuts in supervised visitation as of July 1st. We are also requesting some report language related to supervised visitation in the budget as well. And I have submitted both of these requests in detail to you and would be happy to answer any questions you have as you are working on your requests.
Sarah. Thank you, Sarah. Okay, Helen?
Thank you. I'm Helen Laban. I'm Executive Director of the Vermont Healthcare Association. We represent skilled nursing facilities, assisted living residences, and residential care homes. We are just mostly here to support what the House has in their budget. So both the House and the governor recommended nursing home payments, which follow an established formula that I can discuss in great detail if anyone wants information after my 2 minutes, and some adjustments for utilization. And then additionally, we are part of the Long-Term Care Crisis Coalition that's worked with the House to add funding for bringing up the rates for some of the home and community-based services. That includes both funding to bring rates closer to the 2023 rate study estimates for those rates who are not quite at those estimates, and then across the board 2% increase. And we support that as well. I believe you have written testimony from the coalition that lays out what that is in the budget. I just wanted to, I don't want to sound overly glib about this, but it is at the end of the day kind of a simple formula. The number one predictor of whether you need long-term care services is age, and there's not much subtle about Vermont's demographics. I know that you've seen those numbers, and we are seeing that play out. I also do want to make the point that our members are residential care facilities, which means we're people's homes. So it's particularly important to maintain access across the state, to not take folks out of their communities, their home, and their family social networks as they age. The goal is to help people age in the region where they have been in Vermont. And so we find it particularly important to both fund these services and also fund them throughout communities in our states. We have seen closures, and we would like to reverse that trend to keep this network there. So that is all I am here to say. Thank you so much for considering and hopefully supporting what the House has proposed for funding.
Thank you. Matt Leff?
Yep. Good morning. Thank you for giving us some time. My name is Matt Levin. I'm the Executive Director of the Vermont Early Childhood Advocacy Alliance. And I'm here today speaking on behalf of the network of providers in the state that provide children's integrated services, which is a complex combination of service delivery that is unique around the country really, and provides a dynamic way of providing services to kids 0 to 8 and their families who are in crisis, so 0 to 6. So CIS combines 5 different elements: early intervention, specialized childcare, early childhood and family mental health services, home visiting, and case coordination. And this is another one of those requests that's based on a rate study. So there was a rate study that was done recently that showed that the true cost of care is $738 per member per month. The current rate is $650 per member per month. So it's an $88 difference. And what we're asking is for additional funding that would help close that gap. The House Human Services Committee recommended $450,000 of an increase, which would allow for a $25 increase in the rates. That was not accepted by the Appropriations Committee, but we appreciate their support on your sister committee across the way. And any funding that was available to increase the rates would help. As with other parts of the healthcare delivery system, the low rates impact the ability to deliver services and impact the people who are delivering the services. And in this case, since some of these federally required services, it means we're out of compliance with federal law. So the early intervention services are not being delivered in ways that are really required. And everyone does the best they can. It's a difficult situation, and any funding that was available would make the situation better. So again, it's a request for a modest increase in funding for CIS that would allow that rate to increase closer to cost.
Thank you.
And information is been sent to you electronically.
Oh my God.
Great. It's Amy. Okay, it's great. So I am going to stay here and be Amy Rose. Who just great.
All right.
You got her connection back.
You don't have to be
Great.
in your rows, but don't go away.
I won't.
Go ahead, Amy.
Thank you for the opportunity to speak today. For the record, my name is Amy Rose, and I am the Policy Director with Voices for Vermont's Children. The Reach Up Coalition's primary goal is to ensure that the program fulfills its statutory purpose by bringing benefits to a level that meets basic needs. We can eliminate children's exposure to poverty by acting on the legislature's intent to remove the rateable reduction. I have a couple of specific language and budget asks for all of you today. One language ask is to require that the unfunded budget pressures report be published along with the proposed budget going forward, including an inflationary marker in the report. It is critical to know the state's obligations when drafting the budget. A combined language and budget ask is to make it clear that all funds appropriated for Reach Up must be used to meet the statutory intent of the program. The state must protect the funding for Reach Up participants and distribute caseload savings to participants. This can be accomplished by either adjusting the rateable reduction or putting the money in a special fund or extending the Reach Ahead pilot. I included the statutory reference for this. And then just want to note that Reach Up benefits are not meeting recipients' basic needs, so there should not be a budget reduction in the BAA until the statutory goals of the program are met. A budget ask is that the Reach Up pilot appears to be a success, but it is scheduled to end in June. The original appropriation was a one-time $2 million stipend to cover the 2-year pilot. Make this pilot permanent or at a minimum extend it. There has not been a clear communication with the current participants about the pilot's end date. And then the budget ask is to take steps towards eliminating the rateable reduction as passed in Act 49. This could be accomplished by mandating that a fixed percentage of TANF funds be used to supplement the general fund allocation for this program. TANF's primary goal is economic security, and we use less than 5% of our federal TANF dollars for Reach Up. Thank you.
Thank you, Amy. Elizabeth Gelman. Is she? All right, Elizabeth.
I have a feeling it's me.
Okay, you are Elizabeth Gilman.
Yeah, today I am here on her behalf.
Thank
Hello. Hello, I'm Beverly Bogat. I'm from the Vermont Early Childhood Advocacy Alliance, and I'm here today on behalf of Elizabeth Gilman, who was unable to be here to join you, unfortunately, due to internet connectivity challenges. Elizabeth is the executive director of the United Ways of Vermont, and they run the Vermont 211 system. Vermont 211, as some of you may know, especially if you saw us on 211 Day here at February 11th at the State House. Vermont 211 is a free, confidential, statewide information and referral system that serves all Vermonters with a connection to Health and Human Services. They support the state not only with in times of people that have routine needs for health and human service access, but also in times of emergencies and disasters. And they also have a unique role in providing after hours emergency connection. They support the emergency housing program with answering phone calls after hours, weekends, and holidays, and the state's emergency DCF emergency department, economic services department staff are unavailable to take those calls. They strong 211 is critical at all times, but especially in times of crisis or disaster. We are here today to ask for one, to show appreciation for the House for including an additional $332,000 on top of what was in the governor's recommend in the House budget, and for the Senate Appropriations Committee support for that ask. That money is necessary to ensure 24/7 operations continue and are maintained for 211. So that's
thank you.
Offer today.
Great, terrific.
Thank you.
Well done, yeah. Is there anyone else who we haven't heard from who's is here that we don't have?
Want me to check them all?
No, okay, we're good. All right, we're fine. That's great. Thank you. So committee, we just heard, we had the fire hose. We heard a lot, and we know that there are significant needs out there. What, I just want to say something before we wrap. Kiki and Nolan have been working just extraordinary hours and time to put all of this together. And so I just want to say thank you. And Kiki actually has a brilliant idea for improving our process next year. We're here to improve it. It's great. And so my ask of you is this. You all have the information on our webpage. So there's a lot there, maybe not all of it. But in the meantime, our Joint Fiscal Officer, Nolan Langwell, is going to be putting together a spreadsheet like this. There are some redundancies in what we heard. There are also some things that are in H91. There are things that are already in the budget, both the governor and the House. So I think we might want to place all of those in one category and have a separate conversation about how we feel about those. My thinking is that as you go through your thoughts on what we prioritize, because we do need to prioritize. We can't recommend all of this. The Appropriations Committee will not be happy with that. And I'll speak to our priorities when I'm in committee down the hall. I think, there are some things that we probably need to do, like there are some gaps in between one care and the next step. There are fundamental prevention issues involved that include both kids and adults. So thinking about that, sort of the moving upstream has always been a theme in here. But I can't tell you how else to balance this, because each one of us has heard information and we each feel strongly about issues. Our goal on Tuesday, and possibly a teeny bit of Wednesday, is to fine tune our proposal and support for our top requests. We don't have a money amount. Last year we had a specific amount, had achieved that. We don't have that this year. So that's scary for me. And then the other one piece is we did not hear from legal aid. We had talked in here, or at least I had talked in here, about the Medicare shared savings program and raising it from 145 to 150. That also is something that legal aid is interested in. And then the Bridges to Health, which is a program for those who are very much underserved and ineligible for Vermont's healthcare support. That also will be on your list. We didn't hear that testimony. That's all I'm going to say about that. So yes, Nolan, tell us.
For the record, Nolan Langwell, fiscal. So I've been working on putting together a sheet. I don't have everybody's in here. I just put in what I had received as of last night. My goal is to keep working on this and hopefully if I can get it done sooner rather than later, I'll email it to you so you have it. I might not get to finish it till Monday, unfortunately. We'll see. I want to just flag a couple of things. One, as the chair said, there are some things in here that we had received documents for, but the people did not testify on. So just be aware of that. The other thing too is this list has lots of typos. You will find them. I do my best to try to take people's testimonies and compress it in a sheet size. So it may not capture everything that people want to say. It's just a summary. I'll rely on you to read this documentation separately. But finally, in the sheet, they're in no particular order. They don't represent priorities or anything like that. They're just the order for which I put grab the document, put them in. So I don't want anyone to think that because such and such is higher or lower, that it was because it represents some priority or my priority, anything like that. It's just the order for which I received it and entered it in. So that's all I wanted to say.
Thanks, Nolan. Okay. Nolan, thank you. I know it's a lot of work. We can't tell you how much we appreciate it. So if keep your eyes open for Nolan's email and do the best